So here we are at an NHS hospital in Colchester, England. Timeout. All right, excuse me. There, that's better. So let me tell you about the East Sussex and North Essex NHS Foundation Trust, or ESNEFT. Say that 10 times fast. The National Health Service, or NHS, is the publicly funded healthcare system for the United Kingdom. ESNEFT is a trust within the NHS that serves the North Essex and East Suffolk communities of East England and employs 10,000 staff across 8 hospitals, care facilities, including the hospital behind me. ESNEFT's mission is to provide the communities they serve with excellent healthcare, and their philosophy is simple: time matters. They're committed to removing or improving the processes that take time from patients, families, and staff. ESNEFT's purpose in doing so is to enable employees to do more with their day and allow patients to focus on their families and their own wellness. This philosophy has never been more important than it is today as the industry continues to face challenges stemming from the pandemic. Now let's turn to Blue Cloud and how they are leveraging their platform to support ESNEFT. The global pandemic has shocked and strained administrative staff across healthcare facilities and created a substantial backlog of paperwork. Blue Cloud has been instrumental in helping address this challenge through their digital worker solutions that work across different data sources to collate patient information into a single source of truth, saving their staff valuable time that can be redirected towards patient care. So I want to show you a demo of what's been built here. A critical initiative for healthcare organizations globally is antibody testing, which detects and measures the presence of antibodies in a blood sample related to infectious disease to determine if someone has previously contracted a virus like COVID-19. These results help healthcare officials to get a more holistic picture of infection rates and even collect life-saving plasma for sick patients. ESNEFT needed a solution that would allow them to administer testing at scale without causing a service bottleneck for their staff. The challenge was complex, but the answer was relatively simple: automation. Let's see that solution in action. So, if a citizen wants to request an antibody test, they would first visit the ESNEFT website to fill out a simple questionnaire created with Microsoft Forms. I simply select the hospital, fill in my name, add some basic information, and hit continue. I then get redirected to a set of standard COVID-19 questions to determine if I am eligible for antibody testing, helping to appropriately prioritize my test. Once I complete the short questionnaire, my form is loaded into a pending queue and picked up by a Blue Cloud digital worker. So let's take a look at what happens now. On the back end, the digital worker receives a notification to review the form and logs into the online appointment booking service embedded in ESNEFT's digital exchange platform. Using the information from my form, the digital worker searches the system for my account or creates a new one. It looks like it's found me here and already extracted the information from the data in the antibody testing form that I filled out. So this is all powered by Microsoft 365 and Microsoft Bookings. The digital worker is then able to automate the entire scheduling process. And exactly 29 seconds after I submitted the form, here's an email letting me know that my request for an antibody test has been approved and scheduled. Blue Cloud's customizable dashboard hub gives ESNEFT's administrators visibility into how many digital workers are currently running, the various workloads these automation bots are taking on, as well as processing time associated with each task. Digital workers have vetted, processed, and quickly secured and registered over 20,000 tests in just the last 4 weeks alone. Traditional methods of processing this volume of engagement and scheduling would have been impossible for hospital staff to manage. Digital workers are providing an invaluable service that enables healthcare employees to really focus their attention on delivering exceptional patient care. During the first 6 weeks of the pandemic, Blue Cloud deployed 5 new automation projects to help save care teams more than 7,415 hours. That's almost 200 weeks of testing time. These results aren't limited to ESNEFT. Automated solutions like this one and many others can be accessed by any NHS organization across the entire UK. This drives digital transformation at scale. It's powerful to see what's possible when partners collaborate.